Welcome back on the AM show. Now, it's the commemoration of World Malaria Day. It serves as a poignant reminder of the ongoing battle against one of humanity's oldest and deadliest foes. Oh, did you say you got bitten by a mosquito recently? Well, malaria is a disease that has plagued civilizations for centuries, and it continues to exact a heavy toll on communities around the world, particularly in regions like ours, where access to healthcare and resources is limited. However, amidst this challenge, there exists a beacon of hope, a global movement aimed at raising awareness and fostering action to combat this relentless scourge. Now, BLISS GVS Pharma Ghana holds this day very significant as it underscores our unwavering commitment and dedication to improving global health outcomes. So you may be afraid of the HIV, AIDS, and all those other things, but have you taken stock of how many people die of malaria, especially in tropical Africa? Joining us for a conversation on this, we have David Deladem Tete. He is Chief Pharmacist, and Jean. Okay, so I think I'll have to... What's the first name again?
Jean.
Jean.
Yeah.
With a double N?
Yes.
Okay, that's interesting. I didn't want to butcher his name. Jean Bwedi Boateng. He is Manager, Greater Accra and Eastern Region. Thank you, gentlemen, for joining the conversation.
Welcome. Thank you for having us.
If I asked you as just a pot boiler, sort of, what's the state of malaria in our part of the world, what would you say? I know, I've taken you, I've thrown a hot potato at you.
The state of malaria in our part of the world is scary, very scary, in the sense that the number of people that die on a daily basis, extrapolating to monthly, to yearly, it's a lot. So it's a scary look at how our part of the world is handling the oldest and deadliest disease, that is the malaria.
I'd like, though, Jean, for you to elaborate a bit on the significance of World Malaria Day. I mean, year in, year out, we do this and all of that. Are we even making any impact?
Yeah, we are. We are. So I think yesterday or last 2 days, we normally have donations to hospitals. Yesterday, something interesting happened at one hospital. The amount of drugs we wanted to give them, they were like, oh, they might not be able to consume that much because the cases of malaria they get
have fallen,
has dropped. Yes. And I was like, wow, that's very interesting, because hitherto they would have been wanting to take all these drugs to use. But now it looks like, well, in some areas, in some vicinities, the cases of malaria has dropped. So we are making headway.
Well, I've been reading some of the reports in the past, and indeed, we are making some inroads, but in some other parts of the country, it's still a dire situation. That's what we ought to be tackling. But tell us about Act for Africa, the ACT, Act for Africa, and this initiative. Tell us a bit more about that.
So the ACT is basically an acronym for the artemisinin-based combination therapy. It's a campaign that BLISS GVS Pharma has taken upon itself to embark on. And in this same campaign, we are embarking on journeys where we are looking forward to making significant contributions into eliminating malaria in our parts of the world. So we do this through donations of medications to hospitals. We do education in nursing training centers, market activation. We meet one-on-one with various stakeholders. And then we go through severe and series of education on malaria and how to help eliminate malaria.
Yes. So we are looking for a malaria-free continent, huh?
That's the ultimate goal.
That's a tall order.
Yes.
To add to what he said, the ACT also means act, to act now. So we are not just waiting for the rainy season to start before we start making noise on malaria, how to make sure you sleep in treated mosquito nets, clear your choked gutters. So whenever you get the chance, just act now. If you're given a drug, take everything. If you can prevent a mosquito bite, act now.
In the past, some of your leadership has spoken about, this drive and your commitment to improving global health. BLISS. How do you see that happening in terms of tackling malaria? Let's start from right here with Ghana. Even as you talk global, let's start from right here in Ghana. What are some of the things you're doing beyond this?
So aside the donations, we have, they are called CMEs, Continuous Medical Educations with health facilities. So let's say, for example, let's say we go to Kolebu, and we engage maybe the pedics departments. We have talks on our drugs. We have talks on how they can engage their clients. We go to pharmacies. We talk to the pharmacists. We talk to the MCAs. For example, if someone comes that, oh, I have malaria, you just don't serve an anti-malaria drug. You first do the test. Even after you give them the drug, how they should take it. You know, some people take the first 2 days, and once they are feeling okay, they just stop. So aside the donations, we engage these health professionals to also talk to their clients and patients.
It is impressive, though, that for some years now you've been on this campaign, you know, seeking to fight malaria. Sometimes I'm careful about using the word eradicate because it's another ball game.
Yes.
If you go to Cuba, where I've spent some time, they've succeeded in that. But they have other things like Zika, among others in that region. But what would you say has been achieved in these last few years of your drive?
So we look at the medication donations we are working on now, and then once we start tracking the donations, we realize that the medicines we are donating to the various hospitals are being used, and then you know, in these particular hospitals in the areas, the malaria cases have reduced. And that to us is an achievement.
So the caseload has gone down?
Yes, in those areas. So we're looking at making it a holistic something we are looking at. So in the long term, we're trying to make sure that if not totally, we will just reduce the cases of malaria in our country. I mean, we can't do this on our own, so we have other stakeholders that we are partnering with.
And in terms of these health institutions, generally the feedback has been positive, right?
Very positive. Very positive. I think last 2 days we even went to National Malaria Elimination Program.
Yes.
We also went there to partner with them to find out what help they need from us, so we can also support them in fighting malaria. Yeah. So I think quite a number of people are interested in trying to eradicate malaria in quotes.
You've also had some engagements with health institutions, the training schools, nursing schools, and the rest. What exactly is the target of such engagements? What are you hoping to achieve? What have you achieved so far?
So
okay.
We can start with you. And
yes.
He'll chip in.
So we're engaging the health professionals because they are in the first line meets with the patients. So when somebody falls ill to malaria, they go to the hospital, they meet the nurses, the doctors. So we engage the nurses and the doctors because they have a direct contact with the patients.
Right.
And so far, we have achieved this with our interactions with the nurses, with the doctors, with the various CMEs we are doing, the educations we are having with the nursing training schools, and in market activations, so that we also need to educate the people that so once you get malaria, you don't need to do that on your own, do the treatment on your own. You need to get tested either at a pharmacy or a hospital first before you get into the treatment.
Okay, Jane?
So I think you spoke of the nursing training. So the idea behind the nursing training was that normally in the vicinity, once someone gets to know that he or she is a nurse, mostly any illness at all, any disease at all, the first person they'll go is to the nurse, anti-nurse, or this. So we try to educate them on malaria, because malaria has symptoms close to other diseases. So let's say if someone in the community comes to you as a nurse that his or her child has malaria, what should you do? What are the steps you should take? What education can you give to the person? Wherever you are staying, would you be able to communicate with your community to just check out for choked gutters, treated nets, and all that? So that was the idea behind the nursing training schools.
Moving forward, what then is the plan? BLISS GVS, and what can we look forward to when it comes to eradicating malaria? I have used your term, which I tried to stay away from.
Malaria.
What is the plan?
So the plan for BLISS GVS ultimately is that for us being a research-centered institution, we are looking at innovative ways to tackling this disease. So different formulations of the medication, whether be it tablet, suspension, suppository, any other injections, any other way that we can be creative enough to tackle this disease. We are looking into these areas, and hopefully we are going to achieve what we set before us.
You're hoping to make some major inroads in that.
We are very
just to add to what he was saying.
Right.
So I think last year we even launched a drug that you have to take just one tablet a day for 3 days, because we also had feedback from the doctors that for some of the medications, patients are not able to stick to their doses. So we had to go back, come out with new ideas to how to make patients adhere to their medications.
So with the regular Lonats, taking 3 times, twice daily, 3 times, like 3 days, twice in a day. Now with this new...
No, I completely understand. I have friends who tell you, Charlie, they've taken it for a few days, they're feeling better and they want to stop. And you tell them, follow through. But people naturally, so maybe if it's simpler, 3 tablets, they are good to go. But how can other institutions, organizations partner you, help, support, so that you get to the end of the race, the finish line?
Right.
Quick thoughts on that.
Yes. So we are grateful to the National Malaria Elimination Program, because once we reached out to them, they also expressed their interest into combating this disease. So if anybody out there wants to take this on to, they can just reach out to the Ministry of Health, reach out to us, reach out to the National Elimination Program, and then we just partner, draw a plan, and then we just tackle the disease.
Jean, final words, any call to action?
So I would like to educate all of us, including myself. Let's look at the preventive aspects, even as much as looking at the curing aspects. Let's try to prevent malaria. So in the long run, we'll have a very safe country.
All right. Thank you very much, gentlemen, for having joined the conversation. Of course, we are grateful for the work you're doing. Mosquitoes don't discriminate. They fight everybody. So
they don't.
If you think you are hiding in your corner, and just one can do damage. Those who joined us for this conversation, David Deladem Tete, he is Chief Pharmacist, and then Jean Wedi-Boateng, Manager Greater Accra and Eastern Region. They are with BLISS GVS. Stay with us. We'll be back with more action right here on the AM Show.